So we're always going to identify our patient by agency protocol. We are also going to follow state and federal regulations. We are going to abide by standard procedures or standard precautions, make sure that we're wearing gloves, hand hygiene. We are going to ensure patient safety and privacy, as well as promote good body mechanics.
Okay, so I am going to be going over the irrigating of the colostomy and then performing the ostomy application. So the first thing we're going to do is we're going to locate an IV pool. We're going to ask our patient whether they prefer to be in bed or on the toilet. If they are going to be in bed, we're going to make sure to position our patient upright. If we are doing the two-piece system, we're going to be connecting the tubing to the container. So in this case, we are going to just be clamping this, the tubing. We are going to be filling it with warm tap water. It should be between 500 to 1,000 milliliters. We're going to also be priming the tubing and filling, so by releasing the clamp a little bit, hanging this over like a sink or a toilet, and filling the tubing up with the solution and then clamping it right back up. So once we've got that all done, we are going to be hanging the solution on an IV pole. We are going to be making sure that the solution is over the patient's shoulder and above the stoma site. Once we have adjusted the IV pole at shoulder length to the patient, we are going to remove the old colostomy bag. So in doing that, we can use a silicone base adhesive remover. Okay, so with the silicone adhesive remover, we're going to be taking one hand and we are going to be applying it, and then with the other hand we are going to be taking the waiver off, following the where we have applied the remover. We are going to start at the top and work our way down. We are going to make sure that we throw the waiver in the bag away. We also are going to be assessing the site, the stoma site. Next thing we're going to be doing, we are going to be attaching the sleeve to the stoma site. There's two different types. There's one that has an adhesive on it. In this case, we don't have one. So we are going to be securing the belt. So we are going to stick these little straps into the hole there. We're going to be wrapping it around our patient's waist or their back and placing the opening over the stoma and then securing the other side of the belt. Okay, since my patient is sitting on the toilet, we want to ensure that the sleeve is below the stoma site, but we're not going, since this is long, we want to make sure this doesn't touch the water on the inside of the toilet. So another thing we could do is place a waterproof pad on top of the patient's thighs with the sleeve placed right on top of it. After that, we are ready to go ahead and irrigate. So we're ready to place the cone in the sleeve here. So we are going to open the top of the sleeve and place the cone on the inside here. We're going to hold it firmly in place there. And then we are ready to unclamp the solution. We want to, for every liter, it would be 5 to 10 minutes, or whatever the patient can tolerate. If the patient complains of discomfort, we are going to stop it for about 15 to 30 seconds, and we're going to ask the patient after we've just continued to take deep breaths. Once we've instilled the amount of solution, we are going to clamp the tubing, remove the cone. We are going to place something around the cone, like a glove, a washcloth, toilet paper. After wrapping our cone up properly, we're going to dispose of that later on. We are going to clamp the top part of the sleeve. We are going to ask our patient to sit there until all the contents have been irrigated and have been released. We can also clamp the bottom of the sleeve here, and if our patient is able to do so, we can have them ambulate to kind of promote and stimulate evacuation of the contents, or we can even ask them if to massage their abdomen. Once evacuation is complete, we are going to open up the sleeve, top part of the sleeve, irrigation sleeve, and then we are going to set it aside. Then, following the removal of the irrigation sleeve, we are going then to cleanse the stoma and peristoma area and allow it to completely dry. So we've already removed, I've explained the removal of the colostomy bag. We would use our silicone-based adhesive remover to take off the old colostomy bag. We would also do what we did previously and make sure that we are cleansing the site off. Skin cleaning agent with a pH of 5.5. And we're going to allow it to dry. We are always going to be assessing the area, noting any abnormalities, severe redness. The next thing we're going to do is measure the stoma, the circumference of it. Here I have a standard stoma measurement tool. I also can measure from side to side and estimate the circumference. We're going to measure it, our stoma here, and get our measurement. After that, we are going to place a wash rag over the stoma, over the site, and then proceed to cut our the proper measurement on the back of our wafer here. Depending on what we get for the circumference on the stoma, we are going to add an additional 1.5 to 3 centimeters when we are cutting this. So we would cut it just along the lines of the circumference that we need. And then once we have our proper measurement, we can then remove the washcloth and put any skin prep or anything that is needed for this before the application of the wafer. And then of course allow it to dry completely. And then we are going to take the adhesive part off of the back of the wafer. We are going to place it right around the stoma. And we are going to press around and ensure that there are no wrinkles or anything. We're going to try to get it as smooth as possible. We're going to hold it down between 30 and 60 seconds to ensure attachment. Where's my little piece here? So this one, we actually have to attach the bag to it. So in doing so, we would attach it just like that and clamp it on. Some of them I've seen also twist on. And then we're always going to make sure that the opening part of the bag is facing towards the patient's feet. Once we have secured that on there, we are going to make sure that we are clamping the end to the colostomy bag. As we are done securing the ostomy bag, we are going to take our gloves off, ensure our patient is comfortable making sure they're put back to bed in a comfortable position. We are going to then dispose of any used materials, old colostomy bags properly. We are also going to cleanse the irrigation device with mild soap and water. We are going to make sure that everything gets back in their proper place, that we remove our gloves, we wash our hands,